Well, I've been in the envious position of being able to see the partnership more or less from day one, and at the beginning, when it was known as the Central Oregon Partnership, and early on we were working on the Deschutes County Community Plan, a 10-year vision kind of thing, and it was right when the partnership was coming to town, so it made sense that they would be a logical partner in that, so we introduced ourselves early on. And I think most folks know that there were kind of like two stages of the partnership: the earlier Central Oregon Partnership that had the community action teams, and then about 5 or 6 years ago, changed significantly when Jim Shell took over as the director, and I was working with him a lot on the 211 program, getting that one up and operated. So then I was more of a participant than an observer, and now the last couple of years I've been a member of the board as well, so I've seen it from a couple different perspectives. One of the things that to me identifies the success of the partnership is thinking about what the community might be like without it. Right now it is kind of the convener group in one of the few entities that looks at the nonprofits and the bigger issues around poverty and economics at a regional level, and nobody else is able to do that. We talked about the the VITA program for a number of years, and the first couple of times around it's something that United Ways have been involved in around the country. More and more United Ways have focused on income, basic family stability, and income is a big part of that. And for folks that qualify for the Earned Income Tax Credit or the Child Care Tax Credit, that can make a transformational difference in their livelihood. So it made sense that we be considered as an entity that maybe could take on that program.
It's a combination. We have a lot of singles because of what the economy is right now. We have a lot of single people who aren't making very much money. I mean, they're getting by. We have a lot of college students, people who are going to COCC, and we have a lot of families, a lot of Latino families in these credits that really make it for a very, very large refund that they can then use to help support themselves or pay off major bills or purchase something that they need very badly but with, not possible under their normal income.
There's a natural community among pastors and churches, so that isn't new for us. There's groups that have already established that, but the interesting link has been bringing non-church entities, non-church people to the table with churches, with pastors, and it's formed a much stronger network. We had food banks all over the place, clothes closets in multiple places, so we talked about ceasing to duplicate efforts, streamlining services, providing more effective resource to people. Instead of sending them to 10 places, how can we send them to one place? Our most recent effort now is our medical clinic that we are currently in the process of planning, and the goal of this is to provide free health care to people who are uninsured and people who are over 18, otherwise not covered by Oregon Health Plan.
What Open Campus means to Prineville is it's a program, it's a concept, it's an idea on how do we provide educational opportunities to place-bound students. So whether they be students just coming out of high school, might be students in high school, folks who need retraining, folks who have a job but want to better themselves, or it might just be folks who want to improve a hobby or an interesting need that they might have. What we've done here in the building, one of the first needs that came about was bringing credit college classes back, and really the community college level. And COCC has been a tremendous partner to step up to the plate and meet that need. And going from a couple of classes taught in a rented classroom now to having over 13 classes offered per term with waiting lists, it's been incredible to see that. In fact, was just communicating with a student the other day who he happens to be in our server technician school, and he mentioned about He got into it because he was out of work, was looking for a job, and this kind of sounded cool to him. And so he got into this, and now he's one of our lead students, and we might even have the opportunity to get him placed into a job before he finishes the program.
Probably the biggest factor is just having it accessible to somebody like myself. I live in La Pine with my wife and my daughter. We're a single income family. I bring the only money into the house, so there's not a whole lot of disposable income available. So for me to go out and do something like this is a pretty big decision. And like I said, most of the time, totally out of reach under normal circumstances. I mean, by June, I'll have, if I go through the whole program and do all the certifications, I'll have 10 certifications by June. And I started in September. That's a huge benefit in a very small amount of time.
One of the pathways out of poverty, out of relying on somebody else to support you, is education. And there's incredible value to that.
I would describe Mosaic Medical as a comprehensive primary care network that is targeting our most vulnerable and underserved community members. And someone that accesses the services that we have at Mosaic would benefit from primary care services as well as behavioral health support and social help support. So we started in 2002 in Prineville. The community there realized there were a lot of gaps in care for the underserved community, and some of the care was happening in the emergency room and really not connected in with a comprehensive primary care center. The community came together and learned about federally qualified healthcare centers, wrote a grant, and we were funded to open our first very small clinic. As we've grown, we've expanded throughout Central Oregon. We now have a clinic in Madras. We have another location in Prineville, School-Based Health Center. We have a location in Bend, and now we also have a School-Based Health Center in Redmond. And we've gone from 12 employees to 150 employees, and we've gone from 600 patients served to over 17,000 in the last year. Partnership was instrumental in the beginning, so helped with us getting our feet under us in the first year. We also struggled kind of midway through our journey, and partnership helped with a loan to help get us through a hard time. And then when we implemented our electronic medical record, we worked with Meyer Memorial Trust to get a grant and a loan, and they required a guarantor, and so partnership was gracious and did that for us so that we were able to secure those funds to go into the new age of technology, which is so essential as we go forward in healthcare.
So COIC opened CET in 2008, and it provides community connector shuttles between all the Central Oregon communities. We tend to be used by folks who don't have a whole lot of other options. This is seniors, people with disabilities, low-income individuals and households. Increasingly, we have tons of students using the system, particularly going to COCC. And we have all the communities connected. All of our communities, you can get from La Pine to Bend, you can get from Bend to Redmond, from Redmond to Prineville, Prineville through Redmond to Madras, etc. We didn't have any of that in place 10 years ago. And without Cascades East Transit, a whole bunch of these folks don't have other options. About a third of our riders have said in our surveys that they would not have made the trip were it not for Cascades East Transit. I think the question has moved from, do we need transit, which used to be a question in a lot of the communities. I think we've proven that it's a vital and important and essential part of community infrastructure.
Well, we're the region's link to volunteer opportunities, so anybody who's looking for a place to volunteer can either go on our website or call us and get connected with a volunteer opportunity possibilities with over 100 different organizations. Well, in addition to getting the planning and the whole operation started, the partnership put in a significant amount of funds, $15,000 the first year before we started, and then $15,000 the second year. So that was really made all the difference in getting this off the ground. Well, Project Connect is the biggest volunteer adventure and event in our region. There are over 800 volunteers who are involved with Project Connect each year. So it seemed a very good fit for the volunteer center for our region to be managing Project Connect. Well, I think of the partnership as an organization that has really looked at the root causes of poverty and figured out some very clear strategies for helping people to take charge of their own lives and emerge from poverty.
If it weren't for funding from the agencies like Partnership to End Poverty, particularly the startup funding that you guys provided, we wouldn't have been able to pull this system off.
I would hope that we would be able to look back and say, you know, things are different, and be able to then draw a dotted line to some of the programs and things that the partnership did that helped bring that about.